Good morning everybody. I am Dr. Nitin Joshi, Professor in Urology with teaching experience of 25 years, working as consultant neurosurgeon in Panvel more than 25 years. Today we will discuss two important topics, that is how the centrally acting and peripherally acting muscle relaxants and obturator jerk help to prevent or reduce the incidence of obturator jerk during TURBT of the bladder tumor present on the lateral wall. Now, the skeletal muscle relaxants are the drugs which reduce the muscle tone by acting centrally or peripherally. Centrally, that is, they act on cerebrospinal axis, and peripherally, that is, acting at neuromuscular junction. Centrally acting skeletal muscle relaxants are the drugs which selectively act on cerebrospinal axis, where they depress the spinal and supraspinal polysynaptic reflex, which is involved in regulation and maintenance of muscle tone. These drugs, however, they do not act peripherally, that is at neuromuscular junction. The commonest drugs which are used in practice for central muscle relaxation are benzodiazepine group of drugs. Now, in order to understand how this centrally acting skeletal muscle relaxant reduce the muscle tone and produce the muscle relaxation, one has to understand the physiology of the development of muscle tone. Muscle tone is a continuous or constant state of some tension in skeletal muscle. The gamma motor neuron and the muscle spindle is responsible for development of the muscle tone. It is the efferent impulse which is of the gamma motor neuron which is being sent continuously and synchronously so as to develop the muscle tone. Now, if you see in the spinal cord, there is a S-shaped collection of nerve cells. This S-shaped central area is having in form of the dorsal horn and the ventral horn or anterior horn. In this anterior horn, there are motor cells, there are alpha and gamma motor neurons. This gamma motor neuron is responsible for development and maintenance of the muscle tone with the help of muscle spindle. Now, muscle spindle, it is a spindle shaped proprioceptor present in the skeletal muscle. It is made up of two types of muscle fibers, that is the intrafusal muscle fiber and extrafusal muscle fiber. Now, the gamma motor neuron is responsible for supplying the intrafusal muscle fiber, while the alpha motor neuron is responsible for supplying extrafusal muscle fiber. Now, in case of intrafusal muscle fiber, the peripheral part which is present is contractile, but the central part is non-contractile and acts as a receptor. So, now it is the gamma motor neuron whose synchronous discharge is responsible for maintenance of muscle tone. Now, how it is responsible, that we'll see. It is a sequence of events, because this gamma motor neuron is actually under the influence of what is called as the supraspinal fibers, that is pyramidal and extrapyramidal tract, which is influencing the function of the alpha and gamma motor neurons. Now, continuous control of the gamma motor neuron activity by the input from the higher center. Due to stimulus of the gamma motor neuron, this gamma motor neuron will send the input to the intrafusal muscle fiber. The peripheral part, which is contractile, in response will contract. Because of contraction of peripheral part of intrafusal muscle fiber, the receptor part, which is the central part, will get stimulated. In response to stimulation of the central receptor part, it will send an afferent input to the alpha motor neuron, which is present again in the gray horn of the anterior horn. Because of stimulation of alpha motor neuron, this in turn will send an efferent input that through the motor fibers, that is different fibers, to the extraphyseal muscle fiber. In response to stimulation of this extraphyseal muscle fiber, there is contraction of few muscle fibers resulting into development of some tone in the muscle, and it's the partial state of contraction, and that is called as muscle tone. So though it is the alpha motor neuron which is responsible for generation of the muscle tone, actually the activity of the alpha as well as gamma motor neuron is under the influence of the input coming from higher center, and is particularly the motor area from the cerebral cortex which sends the input through the pyramidal tract to both the alpha and gamma motor neuron, which is simultaneously will be activated, resulting into development of the muscle tone. Also, the brainstem contains the reticular formation which sends facilitatory input to gamma motor neuron, and in turn will result into the stimulation of the peripheral part of extraphyseal muscle fiber, then the central part, that is the receptor, which send an input, that is afferent input, to the alpha motor neuron. Alpha motor neuron, when stimulation, will send an efferent input to the extraphyseal muscle fiber, partial contraction and development of the tone. So these centrally acting drugs actually they preferentially block these facilitating inputs coming to gamma motor neuron, and thus prevent the development of the muscle tone, and hence causes relaxation of the skeletal muscles. Now we'll see how the peripherally acting skeletal muscle relaxants work. These peripherally acting skeletal muscle relaxants actually they block the process of contraction by acting at neuromuscular junction. They do not act centrally, and so there is no sedation or loss of consciousness. These drugs they act as neuromuscular junction. So now we'll see what is neuromuscular junction. This neuromuscular junction is actually not an anatomical continuation, but it is a physiological or functional continuation. It is actually a junction between the terminal nerve fiber and the muscle fiber. The muscle fibers are innervated by the nerve fibers. So muscle fibers innervated by nerve fibers called as motor nerve fibers. One motor nerve fiber is called as axon. Now when the axon reaches the muscle fiber, it loses its myelin sheath. Because of losing the myelin sheath, there is exposure of the central axis cylinder. This central axis cylinder, when comes towards more and more closer to the muscle fiber, it breaks into multiple terminal branches, and then this axon terminal expands itself in form of bulb or button. So axon terminal is expanded to form a bulb or button, and each axon terminal in turn innervates a single muscle fiber. Now this axon terminal, which is expanded to form a bulb or button, contains the cytoplasm called as exoplasma. In that there is mitochondria. Mitochondria is a source of energy-rich ATP molecules responsible for synthesis of the neurotransmitter acetylcholine. This acetylcholine, which is synthesized, is stored temporarily in the synaptic vesicles. Now this axon terminal invaginates the sarcolemma, which is the cell membrane of the muscle fiber. Due to invagination, there is development of depression, and that's called synaptic cleft. This synaptic cleft contains extracellular fluid. This extracellular fluid contains two mainly cations, namely calcium and sodium, and it is rich in enzyme cholinesterase. The exon terminal, the membrane which is facing the synaptic cleft, is called presynaptic membrane, while the membrane of muscle fiber facing the synaptic cleft is called postsynaptic membrane. On the postsynaptic membrane, there are special nicotinic cholinergic receptors which are present. Along with that, there are ions channels, particularly for sodium channel. Now, what is the sequence of event? That is when the nerve is stimulated. For example, when obturator nerve is stimulated during the TURBT by an electric current during the resection on the lateral wall of the bladder. Then, when the action potential reaches the exon terminal, then there will be increased permeability of the presynaptic membrane to the calcium due to opening of the voltage gated calcium channels. This results into entry of calcium into the exon terminal. This calcium which has entered will result into movement of the synaptic vesicle towards the presynaptic membrane, as well as fusion of this synaptic vesicle to the presynaptic membrane. Also, calcium is supposed to help in exocytosis. Exocytosis, it is a process of active transport in which there is release of contents of the vesicle without actually passage of the neurotransmitter across the cell membrane. So, the acetylcholine has been released in the synaptic cleft. These acetylcholine then diffuses from the synaptic cleft and reaches the postsynaptic membrane. On the postsynaptic membrane, acetylcholine combines with the nicotinic cholinergic receptor to form acetylcholine receptor complex. Because of formation of this complex, there is increased permeability of the postsynaptic membrane to sodium due to the opening of the ligand gated channels, resulting into entry of positively charged into sarcoplasm. Now, due to entry of this positively charged ion, there is change in the resting membrane potential of the sarcolemma. There will be change, that is negativity will start decreasing, and thus there is depolarization. And once this depolarization reaches the level of firing, action potential is fired. The fired action potential is then propagated along the sarcolemma and then inside the muscle. When it reaches the contractile component of the muscle, it results into excitation contraction coupling and thus contraction. So, we have seen that there are different steps where there can be blockage by the peripherally acting drugs. Now we'll see how these peripherally acting drugs will prevent the contraction of the muscle. The Obturator block, that is when you inject the local anesthetic in the obturator nerve, these local anesthetic, which is commonly used as 1% lignocaine or 2% lignocaine or bupivacaine, when injected will block the generation as well as transmission of the impulse across neuromuscular junction, and it will be both sensory as well as motor. Since there is blockage of even the motor impulse, there is no contraction of the muscle, and thus obturator jerk will be prevented. Now, peripherally acting drugs, there are two types of peripherally acting drugs which are the neuromuscular blocking agents. One is the competitor blockers, that is the pancuronium or pavlon or atracurium. These drugs, they compete with the acetylcholine for the nicotinic receptors present on the postsynaptic membrane. So when these drugs are present, acetylcholine cannot combine with the nicotinic receptor, and formation of complex is essential for change in the permeability of the sodium and thus development of end plate potential, which is an essential element to generate action potential and which will responsible for initiation of contraction of muscle. Since there is no formation of the complex, there will be no action potential fired, and thus there is no contraction of the muscle. Other type of the peripherally acting drugs are persistent depolarizers, which is choline, that is succinylcholine. Now any excitable cell, that is the nerve or skeletal muscle, smooth muscle or cardiac muscle, is responsive to the stimulus provided it is in a polarized state. Polarized state, that is normal resting cell, there is negativity inside the cell membrane with respect to outside. But if there's already the cell is depolarized, that is negativity has changed to 0, then this depolarized cell is not responsive to any further stimulus. As a result, even if there is a stimulus, then there will be no firing of the action potential, which is essential for initiation of the muscle contraction. So we have seen how the centrally acting and peripherally acting as well as obturator block in preventing the obturator jerk during the resection of the bladder tumor present on the lateral wall of the bladder. Thank you very much.